The two gold standard treatments for obsessive-compulsive disorder involve aggressive exposure and response prevention. And I do differentiate that from CBT, because CBT is a treatment involving having patients dispute irrational thoughts. And there's a lot of irrational thinking with OCD, but the thoughts aren't really the basis of the problem. So I actually don't do CBT with patients. I do more traditional behavior therapy, which is very, very aggressive and very powerful. The other gold standard is utilizing medication. Often these two things are combined. Sometimes a patient will take one or the other. There are some auxiliary treatments that are thought of as potentially beneficial to the two primary treatments. One might be something referred to as mindfulness, which is the mental discipline of becoming aware of how our brain works as a machine, independent from us, the gatekeeper. Mindfulness is the ability to be aware of our in-the-moment surroundings. It keeps us attending to the present moment rather than worrying about the past or distressing about the future. And mindfulness allows us to see our brain's messages as a separate entity from our own identity and our own individuality. So in that regard, I think it's a very positive and powerful potential adjunct, along with things like meditation, perhaps yoga. I think exercise is a wonderful panacea in the support of the treatment of OCD. Exercise is a tremendous antidepressant. Exercise gives a sense of accomplishment, and that wonderful word, agency. Agency means our faith in our ability to achieve goals based on the resources that we possess. Recently, there is a new wave in psychology called ACT, stands for Acceptance and Commitment Therapy. And basically, this perspective in psychology very much supports the very basic foundation of traditional behavioral psychology. ACT brings along the idea of making room for these distressing signals. And when we don't fight anxiety, when we don't fight depression, when we live life through these experiences and go on with our life with an unaltered path, the brain tends to disengage from focusing on these experiences as being paramount, and by backing off of the experiences being the guiding force of controlling behavior, we can kind of take back our lives and live with a lot more freedom. Some of the, I would say, extreme treatments that are coming up recently involve something referred to as deep brain stimulation. I went to a seminar on that, and basically deep brain stimulation is the implanting of electrodes deep into our brainstem. They found a pleasure center in our brain. They found when we experience pleasure, what part of our brain is activated. And so with deep brain stimulation, they take these electrodes and they actually put an electrical impulse into that part of the brain to create a feel-good experience. And feeling good and feeling anxious about some obsessive topic are sort of contradictory, and they have a hard time coexisting. So the idea of pumping this electrical impulse into the feel-good portion of the brain physiologically reduces a person's sense of distress and therefore reduces a person's desire to engage in ritualizing. Another subset of treatment that's pretty radical is what's called a singlectomy. And that is the idea of separating, they're looking for the anxiety center of the brain and separating that from the rest of the brain's functioning in what they hope to be a safe way, in one way that doesn't modify a person's personality. Both deep brain stimulation and the singlectomy are still in their infancy. You know, the brain is still a big black box that we have very, very little solid knowledge about. And so they're sort of poking around with these experimental and very innovative treatments. And at this point, I can say that I have not recommended any of my patients to these experimental treatments because I still find them to be still unpredictable in their outcomes. They're not really coming up with tremendous data results in terms of giving back the results that are reliable and predictably favorable.